by 10,000? Because I thought it was 30,000.
You're talking about the attorney?
Yes,
Well, for 2022, the budget was 25,000.
yes, yes.
And
my
so,
budget shows 30,000. Did you up it to 35,000?
Yeah.
under year-to-date 2022 is 25,000. And under the 2023 column, it is 30,000.
30,000. So you upped it to 30,000.
I upped it to 30, yes, Pam.
Okay, so 5,000 up. Okay. That's what I thought. Just wanted to confirm.
Okay,
I mean, last year we spent 38. But we had
and then the
two
year
off.
before that, we spent 19. And then the year before that, 36. So you see, it kind of goes around and around, and we still have, I know there's probably more attorneys' bills sitting out there and more for the rest of this year. So more than likely, we're going to go above that 25,000. You guys think 30,000 is enough there?
Seems to me it's fair considering you let it last 4 years when you look at 4 years, because you don't want to base it on 1 year. Yeah.
Mhm.
But I think it's good.
Okay.
Strive for.
Say again?
It's something we could strive for.
Yeah.
Keeping
Yeah.
it under 50.
Yeah.
If we can
You know,
get people
that
to stop
engineer-
suing
is
us, we could
David
save
West
some
here?
money there.
Is David West here? No, he's not. is he?
He's not, no.
Under this engineering services, and I was meeting with him at one point, and he was coming up with some different projects where he would need some engineering services, but maybe we'll talk to him about that again, maybe for next meeting. He had some ideas of what he might want to add something in there and take some from someplace else, but that's just, I'm just thinking out loud more or less right there. I'll just circle back to mention that to him again. Maybe he's thinking that 2024, not 2023, but.
Most
Did
of
you
the,
say he was going to add something but take something away?
Well,
Take
he was
something.
thinking about maybe shuffling a couple of things around, but
Okay,
also maybe asking possibly for a little bit of extra money to do some engineering services for some different things.
okay,
Okay, so that might be something that might come up just for a small dollar amount.
okay, but it's
the
not
next
gonna substantially change the bottom line.
No, it's not going to substantially change anything.
Okay,
most of our engineering services are in conjunction with dealing with application, and it gets paid for by the applicant.
Mhm. Then there were some things that he thought he might have to assess, but wasn't sure. But anyway, that's a sidebar. That's a sidebar. And then we were down into buildings, personal services for snow removal. 2,500 seems to be enough. Equipment. But Joel, I'm interfering with your itinerary. I'm sorry. I just got moving in a direction.
Well, I mean, the Jen calls for essentially you walking through the changes. So that's exactly what you're doing.
Oh, okay, okay. We're just looking at now, the other contractuals in the building. These are some items, and the rest info technology and stuff we haven't gone through yet. But you'll see that on the contingent line, we had added 7,000 for the contingent grant match that we talked about.
Yep.
Okay, so we put some extra into that. The rest of it, we've kind of gone through, like the garage contractual. We're doing really well on that and had taken out some phone expense out of that. So we're thinking on garage contractual, we're looking at,
Holding the line.
yeah, we're the increase in paying the heat can be offset by like the phone expenses and the expenses for the internet and everything here that was gone into central communication line. So that's why we were thinking the 85,000 under our garage contractual, just keeping it the same, looking at what we've spent so far this year, which was 55,000, that we're thinking that that would be okay. And once again, we can strive to keep it, under that line item. We were looking at street lighting, We had everything.
Probably decrease the street lighting line, because now that we're all LED, it's less.
We could, you could do that. We've spent $737 so far this year on it. We have a $3,000 budget. What do you think? Do you think we should come down, I mean, 1,000 or something, 1,500 on that line item?
That's what I was thinking, 1,000.
Okay, so we could make it be 2,000. Is that what you're suggesting, Joel?
Yes.
Okay.
What was that, Joel? Sorry.
Street lighting.
Street lighting.
Street lighting?
I'm kind of killing two birds with one stone. I'm hitting upon some of the changes. I'm also attacking some of these line items we haven't looked at yet. So
Yeah.
to save time, I'm kind of combining the two things.
Yep.
Okay.
So what did you want to change street lighting to?
2,000 instead of 3.
Okay.
So we're reaping the benefits of having switched to LEDs.
Right. It looks like it's a dramatic change. Why not go down to 1,500?
Well, because the year's not out yet, and it doesn't take into account the winter, the lights run more.
737 would have counted January, February, March, which is winter.
If that's the full year, we might be able to reduce it more.
It's, according to this, in 2022, it's only $737, which is under 1,000. And this is through
Well, through
9 months
September
of the
anyway.
year, so it's 3/4 of the time.
Well,
That might not reflect, that might not be reflecting the October bills. Probably not reflecting October bills yet. So we still have
That's
3 months.
what I said. That's what I said, 3/4 of the year.
Yeah,
So a
gotcha.
quarter of the year left.
We got a quarter of the year left, yes.
so yeah, we could
1,500.
Want to go down to 1,500?
1,500
1,500.
multiples of
Hey.
5 are easier to do.
Hey, what's $500 amongst friends? Makes a difference, doesn't it? 1,500. Okay, does that sound reasonable? We'll go with 1,500, see where we go with
Yeah.
that. It's not like we're talking big bucks, but we are setting up something for the future to kind of
Right.
hang on to. So, all right, rec partnership, we already have that number. We have that exact number that came in as a quote.
Right.
Down on Jennings Pond, you'll see things arranged a little bit differently. We separated out, our salary lines. We've got separated out for lifeguards, swimming area director, recreation assistant, and then the contractual line, 1,800 for, they have to pay for their phone. They have to pay for their porta potties there. They've got to pay or their, bathroom,
Include the permits.
wash station permits.
Everything they ask for.
And then whatever equipment that they're required every so many years to swap out for safety.
That
So,
was their request to us.
Jennings
So,
Pond, we don't
not
really have anybody giving us a request this year.
No, I'm talking about the park.
Oh, the park, yes.
Oh, the park. Yeah, we're working on Jennings Pond right now.
Okay, pond.
Okay. And then community council. Did I spell that right? I don't know. Community council.
Oh,
those
CIL.
that they said that they weren't asking for anything.
Right, so that's zero.
Changed it to 0, yes.
Good.
Then Danby Youth Commission. Before we named that, we renamed some of this stuff, so it made it clearer. So we know the Danby Youth Commission, 27,285. That was a quote that we had gotten, and I believe in there too, there's some of that is in there. What was it, like $1,000 or something for scholarships or?
Scholarship, $1,000, yeah.
Yeah, I think that's part of that number. I'll go
That's
back
what you
and
said.
check that, but I'm pretty sure that's what I put in there when I was pulling that out of community council's budget and getting the quote for whatever we needed for that Danby Youth Commission.
Does that look right, Catherine?
I did not bring my youth commission folder with me tonight.
Okay, we'll do a quick double check on it, Catherine, for the next time. I'll circle that one. I think it's pretty accurate, but we'll see if there's something we're missing, okay?
Great, thanks.
And you did say that it included the $1,000 last time.
Yes.
That's what we're talking about.
And she said it last time that it's in there.
Yeah, I wrote it
Yeah.
down.
I did wrote it down too.
Okay, cool. Now we've got onto Danby Community Park Association. Before that used to show up in other government support, which would have been one of those exhibits. You would have seen that in one of those exhibits, Exhibit A, actually. And it's been taken out of there now, deducted from that figure, and then put in under this Culture and Recreation, Danby Community Park Association. And it's got the new figure of $7,450, which is what they came and asked for. Okay. West Danby Community Association, $600. The community library, they requested that we stay at 3. Our historian, now that's something, I don't know if we talked to the historian or if you guys have not really discussed that line item, but we do have 1,000. I just put $1,000 in there to produce this budget, which was the same amount that was in there for last year. So I don't know if you guys wanted to discuss that line item or not. And the Danby seniors asked to have their $5,000 again. So that area right in there, and then up here with the code enforcement and the planning is where you'll see things a little bit clearer now on the face of the budget. We go to the code enforcement. You'll see the code enforcement. The only thing is under code enforcement now. Before we had under this code enforcement, it wasn't necessarily, we didn't say, we used the word zoning and stuff. We renamed some of these titles to make it clearer. So now we've got code enforcement with just the code enforcement salaries for that. $500 for equipment. David was, or not David, Steve. You know, my brother's names were Steve and Dave.
Oh
So
my
I kind of
God.
interchanged them. Those were my 2 brothers, Steve and Dave. So equipment was 500. And then the contractual line, if you guys couldn't, I'm going to take this out of there. I have a little, I have software support, supplies, training, association dues. If you could cross off the word postage, I'm going to take that out of there because the postage we've set up, we were talking about it and Janice and Steve and David and I were in and we were estimating the postage for the town hall. And we have a separate line now to encompass that because of the way they're purchasing the postage. That does not include the court. Because I don't believe, does it, Janice? I don't think we put the court in there because they're kind of doing their thing. Okay. And so if we take postage out of that explanation, I try to put little explanations in here and there for you guys with these contractuals. So we've got 5,500 again in there for the contractual for the code enforcement. Then if you turn the page, you're going to see planning and BZA separated out. Under there are the salaries for, and we've got this a lot clearer this time, planner salaries, CAC administrative support, that would be Betsy Kiyokowski right now. We've got a $3,950 for that one. Planning BZA administrative support, that would be the job that Alyssa was doing. I don't think she is right now, but that's where there's a lot more hours and more into the minutes. 7,730. So that, and then under equipment, $500 for equipment, and then contractual line for supplies, dues, anything else the planner might need contractual wise. In this case, 5,500. And Steve was talking about he could use the 5,500 in there. There were some things that he was needing to do that he was going to need some extra for. And he can explain that better when he's maybe through the next time, but I just wanted to show you that's what was in there.
What is it combined for the planner and the code enforcement is the same as last time?
They each have, here now you're going to see, each one of them has 5,500. Steve is going to need books. He has to, by law, he has to replace all his books every so many years. So he's going to need money for the books, money for some other things, like you say, association dues, his software support. He really wants to get going with his piece of software that he has in there, or whatever he's going to go, and go to some more trainings. He feels that there's going to be some more trainings that are going to be coming up that are going to be beneficial to him, that he thinks that he really should attend. So we kept the 5,500 there. And actually, I think David had some trainings and things that he was thinking of. That's why he wanted the extra 25, the $3,000 in that one.
Quite a jump.
Yeah.
But maybe he could be here at the next meeting and explain that better to you guys. But I'm just showing you that it's in there now. We'll let him, I'll circle that so that can be an explanation on the next one. Or maybe he could even send you guys out an email of what his thoughts were on that. How would that be?
That's fine. That would be good, especially since officially the public hearing is in 1 week from now.
I know. Yep.
Public hearing.
Mm-hmm. Mm-hmm.
We did schedule it, right?
Yeah, a week from today. We're not even close.
Oh, yeah, we're close.
No, we're not.
For cemeteries, contractual, the mowing, we went up $500, $4,500. There'll be increased prices in gas, etc., for that kind of thing. Then the
What
employee
percentage is that?
benefits. I'm sorry.
What percentage is that?
Well, we went up $500.
For
What's
gas.
that? Oh, I don't have.
We're going to cover it or not.
Yeah, we went up 12.5%
Yeah, that'll do it.
contractual mowing.
Yeah.
And then the employee benefits, we know the amount for the state retirement. So that's split out between general fund and highway fund. We've got Social Security, there's a certain percentage of salaries that I plugged in for that. Workers' compensation, I kept that the same because as you can see what the trend has been for the amount of money. I don't think we should go down on that because they've been, really, really watching our rates. You don't know. We could have more of a substantial increase this year, and we do not know what that is at this point. So I left that at 14,000. The hospital and medical, this would be based on the platinum plan, hospital medical insurance, the price of the platinum plan, along with Joel's amount that we pay for him, and that also includes the amount that we pay to Keith. They're not on our insurance, but we give them, we pay for the amount that their spouse deducts from their payroll to pay for health insurance. And that's thousands of dollars of savings here. So that is for the platinum plan minus what Joel had originally planned, 25% contribution from the employees. And the meeting that, well, Joel, I'll let you explain that if you want to take that number. We were just talking before this meeting because that CSCA meeting is scheduled November 1st now instead of tomorrow. So we're getting close. And Joel, maybe you can, if you want to, unless you want me to explain, what will take that number up to kind of figure a possible worst case scenario, but.
I mean, we have yet to engage on the negotiations, but they've asked for $5 an hour. So we gave them, so $5 an hour, if we can go to 25%, employee contribution to the health insurance. That would mean that they would be using part of their $5 an hour would go towards the.
Which is a substantial jump over a 1 year
It is,
time
it's about
period.
a
At the end of a pandemic.
$1.20, I think. Something like that.
So they'd be getting a $3 raise.
No, well, it's more like 4. But, so if we're actually going to give them 5, but they're not asking for 5. I mean, they're probably going to. Oh, the echoes hard to deal with. If they're thinking that they might be willing to go from the current 6% up to like 12%, they would be contributing twice as much. That's about $1. So they're thinking that they're getting a $5 raise, which they are, but then $1, they're going to be contributing $1 more. So $1 of that $5 will go towards going from 6% to 12%. For the
Okay,
town,
now you're talking.
for the
about-
town, it's $4. For them, you know, it's 5 minus 1, you know, depending on how you look at it. I would like to, and I proposed that we gradually transition so that they pay more and more of the health insurance costs. I'd like it, I propose that we actually have them pay all of it, but that we increase their pay enough to pay for it. So in other words, it's costing us $12 an hour to cover their health insurance currently. I'm willing to actually pay them $12 an hour more if they pay for all of it.
Well, one, they're getting a better deal on the insurance. Two, that's not the way the current system works. If we had a healthcare system in this country that was not based on employers, that's one thing. It's not. We can't change, the town can't change everybody's positions. That's why changing it in one small period for one small group of people screws them, basically.
I don't see where anybody gets screwed if you're.
No,
paying
because you
them.
cannot negotiate the kinds of things when you're doing on your own, as opposed to group policies.
Policy doesn't change.
They say that the policy would be the same.
Policy will be the
Yeah.
same. Although we are talking about going from the legacy policy that we've got to the platinum plan, which
Right.
is what most of the towns have done.
But that's not relevant to right now, going to 100%. Right now, we're
No.
looking at,
No.
so Laura, what would it change in your numbers if we did do the 12%?
I'm not told, I don't totally know that change in there. I'm gonna say this hospital and medical insurance. If we went from that 20, okay, just a minute. Even if you divided that by 2, it would go up about another 15,000. Our hospital and medical would go up anywhere from 15 to 18,000. But that's not including the people who are not in the union. Joel was proposing that we keep things the same, the $2 an hour increase in pay plus 4% of the current amount for the employees. And we pay 25%. Those that are not in the union, we pay 25%. And we structure it that way.
So you can't easily tell what the difference would be if it was at 12%.
If it was a 12%, here, we were talking about maybe 100.
Or did you say 15 to 18 would be the difference? Okay, never mind.
108,000, about 108,000, 110,000. This figure would be about 110,000 instead of 90.
From 90,000.
If there was a 12% contribution instead of 25.
Right, and I'm doing just the 6 highway workers. I'm including just the 6 highway workers on that.
Okay, so approximately 20,000.
Approximately 20,000.
All right. Considering we're underpaying, that's not unfair.
Yeah, for salaries.
So right now, if you want me to
Wait a
you want
minute.
to up that
Right.
figure, it would be, the increase would be $5 an hour with a 12% increase in their amount of their contribution. And then for the other employees, it is a $2 an hour raise plus 4% of their current minus, and then we would pay 25% of our health insurance cost. And if you would like to see that per person, I could provide that. So you see what David would get bottom line, what Janice would get bottom line, what I would, what Steve, Dave. And then you could
That's
get a
in the
better
budget
idea
now.
if I emailed that to you. And I could email that to you today, probably.
Okay,
That would be good, yeah.
Yeah.
Thank you. Thanks.
You can
But
see
that's
what
in the
that
budget
really
now.
brings it.
it's nice to have it on one sheet.
If it pulls it out, it's easier to see.
So,
Yeah. I don't know how the negotiation is going to go,
right,
but you know, if the plus and minus is a wash for us. You know, if we increase their pay
Right.
enough to pay for an increase in their percentage that they pay,
Right,
same difference, you know, as
Right.
far as the budgetary impact. What we have to get in the budget is the actual dollars an hour more that we're going to be paying them in order to bring them up.
Right.
There's going to be a minimum of 4. And that's if we give them a $5 an hour raise and they go to 12% instead of 6.
And that sounds.
We're talking
actually-
bottom line about approximately an $18,000 change in here, because you're not going to see it in the salaries if you leave them at $5 an hour, but where you're going to see the increase is in the hospital and medical.
Right.
Yeah.
So approximately 18,000. Good, okay.
Or less.
Approximately, that's what it means.
Drug and alcohol testing, you know, we've been putting that under the garage track whenever we do our drug testing. And I'm sorry, I went on to the next line item. We've been doing that. We've got 500, maybe, you know, we'll separate it out. And I usually, if the garage needs budgeted money, I grab it from here, 500, and increase it there. I've been charging it to that, but we really, if we've got a line item for it, we ought to be charging it to it.
Yeah.
I'm negligent in that myself. And then other budgetary provisions, and I was racking my brains trying to think. I believe last year we had the 10,000 other budgetary provisions because we wanted to take that 10,000 and put it in the salt shed, okay? Put it in for our salt shed. And then this year, I just put 15,000 in there, other budgetary provisions, thinking that we're going to take a look at this stuff for the solar, okay? And
All right.
we are getting that straightened out too and trying to locate a contract for it. And I wasn't able to get a hold of Paul. I tried, but I couldn't reach him to see about that contract. So I've just put 15,000 in there for now, because what I'm thinking is that when you do create that reserve, we should look at our fund balance and grab a large amount out of our fund balance and put it in that reserve, because we really kind of should have been doing it. Well, we just talked about starting that reserve, and we've had budgetary constraints in many of the years after that we got involved in that. So we could potentially, that 15,000, once we start the reserve, let's say you start the reserve with 50,000 from the fund balance, if this is something that you want to do. And I'm not even sure if you want to actually call it a reserve, because you might end up not buying this. But if you put it in a reserve specifically for that purpose, that's hard. Maybe we should say we're going to set aside 50,000 out of our fund balance and know that's what that's for. And this 15,000, we will put and add into that. So we would be up to 65,000 now, headed towards that purchase of that solar array if we wanted to.
Yeah, that's good. And I think the purchase is due in 2 years.
Okay, and then if we didn't,
How much it is?
Something like 80,000 is the last that comes to mind, but I can't guarantee
I
that.
think it's 100,000. I think it's
Okay.
100, if I remember right, I think it's 100,00,000.
Trying to get a hold of that contract to know
Oh
what
boy,
we're
I'll
talking.
tell you what. Yeah, it's difficult. Hot on the trail. We'll have it for the next meeting and for the final roundup here to make a final decision. But that to make the actual, you know, setting aside out of the fund balance, we can do that even at the beginning of next year. And that might be a good time to set it, if you, whatever amount you want to pull out, because I tell you, when we wrap up the books for this year, you can see if we added to the fund balance. We may have 30, 40,000 that got added to the fund balance this time. That's a good amount to say, yep, let's set that aside for the solar array. But at least we could budget 15,000 this time to for sure go into that account. See what I mean?
Yeah, it's a good idea.
Things we can do here. There's things that we can do here as we watch it and see how we end up for the year.
Yep.
But we
What
know
we're doing
we gotta-
here, though, is we're depleting the fund balance in order to.
Well,
Fund the
that
solar.
was wrong, Joel. That kind of was
It should have come out of the fund balance yearly.
all
and it
along.
did
It should have
not.
been
So
set
that's why we're
aside
doing it
all
all in one
along.
fell swoop.
Yeah, but whatever you take out of the fund balance is money that you're not raising. You're depleting.
And it should have been depleted year as we went along.
Yeah,
we
it
did
should
not.
have been-
So now
it
we're
should have
doing a
been
one-shot
taken out
deal
as-
instead of what we didn't do all of that.
Unless you
Yeah, but, you know,
Yeah,
but
same
then
effect.
you won't have the money in your savings anymore if you pull it out.
And we wouldn't have that otherwise if we had pulled it out.
This is a targeted savings. I mean, it's not a reserve, but it's a
No, it's true. I mean, it's
targeted for that, and we
yeah.
just need to remember that. We need to
So
make sure.
when they first went into this with the solar, that was the first original thought, even at that time, was to show on the books, taking 50,000 out of what we had at that time and setting it aside for this purchase, and then kind of budgeting for the rest of it as we went along. So if you had 50,000, 15,000 this year, we do another 15,000 next year, that's 30, that gives us 80,000 at that point, and we can figure out the rest. But at the time they got involved in it, that was the original intention, was to take the 50 and set it aside. We just
Okay.
didn't figure how we wanted to do it, whether it was a formal reserve or whatever. So we just let it set in the fund balance as opposed to pulling it.
Okay, so we're not changing anything by doing that. That was the
No.
original plan.
That was the original
No.
plan, was to do it that way.
Good.
If you're talking now budgeting for all of it, Joel, the plan comes up in 3 years, then you're looking at what, another 35,000 in each budget for the next 3 years to accommodate that. I'm not sure if that's, I mean, that wasn't the intended thing to do.
Right. No.
They wanted to use 50,000 to free up those budget constraints as we went along. Then we hit COVID, we hit a lot of different things where, it just didn't happen.
What we did do in the meantime was attack the fund balance in order to balance the budget, so we didn't raise taxes as much. So we've been depleting the fund balance, something like 3 years running. So there comes a point where you're saying, we don't have enough savings set aside in the event that there's some sort of unexpected catastrophe, like we have a storm event like 2015, and
I think we have 500,000 or 600,000 right now, too.
Oh,
500,000 or 600,000.
Oh, that's not, okay. That's not something we should spend time on now then.
I mean, we're not like down to our last dollar or anything, but I understand what you're saying, Joel.
but we are
500,000,
continuing the
600,000.
trend of depleting the fund balance.
Not a big trend, apparently.
Well, how many years does it take to make a trend?
Yeah, it doesn't take a long time to spend it.
I mean, 3 is plenty.
A trend means that we're taking the balance down a lot. It sounds like it is not happening, no matter what you say. But that's not part of this budget, because I am not willing to add any more to this year's budget because we're already up 8%.
But 15,000 sounds reasonable. Going in 15,000, which we had in the original 2023 budget that we started, setting that aside, but other budgetary provisions, that sounds reasonable to you that we could set aside for in planning for this solar array.
Yes, that sounds good.
That's a more comfortable feeling, at least for this year with it.
Yeah.
You okay with that?
Laura, could we get a little, in the past, we've gotten a little chart with the fund balance from each.
Yeah, we're getting to that end stage where we look at what the overall.
Yeah, I'll send that out to you guys again. I did an analysis last year of what our trend was with our fund balance. I'll pull it up and send it out again, okay? Fund balance trend. And I've also got an analysis of the times that we stayed under the tax cap and went over the tax cap. Happened there. Fund balance trend and tax cap. Yeah, I have those analyses. Every time I see Janice looking up, I know she's on her computer. She's probably looking for it now because she probably remembers that I do what I did. So,
Playing
okay.
a game. She's doing a puzzle.
Solitaire time. No, I'm just kidding. So I kind of killed 2 birds with 1 stone there, you guys. I went through this budget. You got to see what the changes were that we made, and we hit upon the line items we hadn't hit yet. So the only general fund right now to talk about and to kind of get to the bottom of where you want to be. Salaries will come along. We know what we're going to do with that now so that we can get a budget passed. And that strategy, even though that we haven't finished union negotiations, is a pretty conservative approach to it. We can do a little change at the last minute if we need to before a public hearing, if it comes across radically different than what we just anticipated it would. Okay, and I'll get out that so you can see that for the salaries, what all of your different employees are going to be, would bottom line be making. And I'm sure that you'll probably hit upon some of that here with the town clerk. So the line items we need, starting at the top of the town clerk, personal services, our deputy town clerk and project assistant salaries have increased. I know Janice had some other ideas about hers that you guys were working on. That's what I heard on the phone when I was there. So I'll just let you guys take it away from there and I'll be quiet. And then coming down through the information technology and website and central communication lines. But we hit them. We hit everything else, guys. You know, we were worried about missing some line items. We did the highway, we've done the water. Now those were the line items that hadn't been hit yet. So you guys were really further along than what you thought, because there weren't a lot of them that haven't been hit. So just getting this part resolved getting this part resolved. Looking at the salaries after Joel, I mean, I think that's pretty much resolved what we're going to put in there. And we'll look a little bit more at that solar array contract. You guys will be able to get some bottom line numbers to see if any that you want to compensate with the fund balance when you're looking at tax rates or you're looking at anything. I did send out a new analysis of where we stand right now, where this stands right now without any changes. The $100,000 of assessment, the tax bill would decrease by $22.60. I say the tax bill per 100,000, that's what we have anything to do with. If a person got assessed more, that is something that the assessment has made a raise in that person's assessment. They're going to see an increase, maybe an increase or not. If their amount stayed the same, assessment stayed the same, they will see a decrease in their taxes. If their assessment raised, like say up to about a mid-level average, okay, they might see it stay the same, but if it's raised a little bit more than that median, then they will see an increase in their taxes, okay? And then with the fire district, $40.10 decrease, and with the water, $54.50 per $100,000 of assessment. And that's because the assessments were up, even though our levy, this budget right here reflects an increase in the levy that doesn't include the fire district, okay? Or because I don't include that in there, of $216,000.17. That's a 9.93% increase in our levy. So you can look at that and keep that in your mind when we come to the end and see how you want to manage that. And hopefully we can come to those bottom lines in the next meeting and be ready for our public hearing. So now we'll
say Laura,
what's that?
did you say 9.93?
Yes. Let me check it again.
Okay.
At 9.93%.
What was the total amount, total dollar value? Was that 9% was based on?
I can't hear you. I'm sorry.
Dollar value was that was based on? You've given an $85,000.
I still can't hear you, Pat. I'm sorry.
Is the microphone turned on, Pat?
It's on, it's just, battery must be getting lower. So. Your light's kind of dim.
You gave, when you gave the percentage, just before that, you gave a dollar. How much was that dollar value? 25?
$216,017 is the increase in the levy right now. Now that will go up. That will go up when we put in the increase to with our health insurance that we just talked about. And then whatever you guys come up with for information technology and the town clerk lines. So that can go up. Do I think that's bad? If anybody were to ask me, given the times and the increased costs that we're looking at here in the highway department, all of our parts, all of our supplies doubling in cost, our fuel oil doubling in cost, you know, our diesel. 3 weeks, for 3 weeks, our bill was over $9,000 in just diesel fuel in 3 weeks, because
Right.
that's because it's up doubled.
Right,
Staying, and I think that's responsibly staying in within some parameters too. And then, of course, our propane to heat, and everything else. So is this kind of expected? Yeah. And a lot of it's offset too by that change in the health insurance plan and kind of coming down on that a little bit. Even though the salaries are increasing, that health insurance is compensating for the total increase in those salaries. So that helped this year to do that. Or
But
that,
now this 9.93%, that's based on the budget you mailed out to us, that you just sent out to us?
it's based on exactly what you just looked at, the one that you just
Right.
got. And that's just with the general fund. The highway and the water you already had, because that was pretty stable. So that is just based on that. Yes.
And what did you say, the fire, how much? I don't know.
The fire district asked for $11,000 more this year.
And what's that in a percent?
They increased by 1.94%. They went from 567,000 to 578,000. So they went up 1.94% in the amount of their levy.
Okay, good.
So Laura, that 9.93%, is that just in the general fund?
Yes, that's general fund, highway fund, and water combined.
Oh,
So it is,
everything,
so it's the overall.
it's overall.
That's overall. It just doesn't include the fire district because they're really their own taxing entity,
Yeah, right.
providing a figure for us. So that's just ADA and SW funds.
Well,
I think-
SW doesn't apply to most of the town.
Well, right, but it's still part of our tax levy.
Yeah.
So it's 16,690. Yeah, you can kind of set aside in your mind, but I can tell you for the general fund and the highway fund, hold on.
You say it doesn't make a whole lot of difference.
No,
It's, it's what you're responsible, 215,849%. About 10%. We went up 10% in the general and highway.
Water went down.
258,849. Yeah, we did, guys.
Well, what we don't want to do is make a whole bunch of increases on top of that.
10%. We went up between just general and highway. We went up 10%. That is going to go down when you're figuring in the water fund with it. I mean, that was nothing, but
Yeah, 0.1%. Some 10% is a lot worse than 9.9.
yeah, it's probably in my rounding too on my whatever I've got my computer, my thing set at right now. So about almost 10%. That's all general and highway. Yeah. Water didn't change, so they kept water at the same.
So yeah. So what do we still got a couple of things that we haven't nailed down.
right,
The big ones are the clerk and the IT.
yep,
So we probably ought to revisit those.
yep.
And that's where I'll be, you guys can, where is that now? I had that right out here.
And that the increase that you had put in your budget for the clerk, that's included in this 10% figure.
Yeah.
So
Yeah.
anymore, it goes up,
Right.
right?
But less than a
Everything that you see here is included in that. So if you take the salary for the town clerk, okay, last year, the budget was 41,379. So if we go up the $2 an hour, which is $4,160, okay? $4,160. And then you take 4% of the 41,379, 1,655. So she's got about a $5,815 increase there. But then when you go, so if you took the 41,379 and you subtracted out her portion of health insurance for 2022, okay? That portion of health insurance for 2022 is $1,618. That would give her $39,760 to say that that is her actual compensation minus out that. So now if you take the new year and you want to take the new amount, the $47,115, and then you subtract out the 25%, which is $6,397, is the 25% of the health insurance for the platinum plan, okay? That would give her $40,718. So that would mean her net pay increase based on what this shows right now is $958 a year.
Is that about 4%?
Yes.
Yeah, it's about 2.41 because I'm taking it based on that 39,760, which is with her health insurance taken out this time. So her 958 increase divided by her 41,379 minus the amount of the health insurance taken out of her is a 2.41% increase.
I intended a 4% increase. How did it end up being only 2?
Because that 4% increase, you take the $2 an hour and add it to it, plus the 4% increase of what she originally had. And then the amount for health insurance taken out is not $1,600, it's $6,400. So there's a large amount for health insurance taken out of that
Yeah.
increase that she had. And that's how that
But
comes up.
the $2 an hour is about $4,000. That.
Mhm,
But then the 4% was supposed to be without that.
mhm. So you take 41,379 and add to that the $2 an hour, $4,160, gives you 45,539. And then you want to add 2% or 4%, I'm sorry, of her 41,379. It gives her $1,655. So you add that together, and the total amount of her raise is $5,815. And the total difference in the amount she has to contribute for health insurance is $4,778.
But that figure we don't know yet,
A little over $1,000. She's getting about $1,000 raise.
and we don't know those numbers for insurance yet. That hasn't
Well,
been determined.
Well, because these are not union positions, we can make it whatever we want.
Joel's
What's
suggesting
in
that.
there, what a budget is based on the 25% contribution. And the intention was to give them a $2 an hour effectively raised to cover the increased cost. So that should have been a wash. And then I wanted a 4%.
That's not a wash, though.
It's not a wash.
Well, it is, I guess,
No, it's not.
Why is it not?
It's the math wrong.
Well,
for 779.
what I intended was for it to be a wash and that there be a 4% real increase in what you get to take home. Now, if it didn't come out that way, it's because the math didn't get done right. But
Well,
that-
no, the problem is you're basing that on current salary, which is not a 25% takeout. But I don't think, but since that hasn't been approved, we can't budget based on that because it's not been done yet. We can't budget based on what's not done yet. Especially if we're looking at 25%, which is a shitload of money. I think what looks more likely is going to be more likely to look like the 12%. So we ought to be looking more at that. But this
Only if we need, we don't have to do for the non-union employees the same as we do for the union.
and it would make more sense if we treat them all the same. Unless
You
there's
could make a case for that.
specific reason for not doing that. I don't see a specific reason.
I do, which is why I proposed it in the first place, Pat.
Yeah, well, I don't see it. But I think this number
Well,
here,
then let's go over it again, because I want to make it clear why I want to move in that direction.
$2, so this, what you had proposed was $2 an hour plus 4%. And that's what this number shows here, and that's what this is based on in this budget. So that's what you would ask for. That makes perfectly good sense.
Is everybody,
So, but is it 4%?
She just said, she
it
calculated
was
it.
So the amount of the increase, Joel, that
2.4?
she would see just in that raise, looking at her salary line, okay, would be $5,815, okay? Now, the difference in the amount that she would be doing, you know, she's gonna contribute $6,397 this time, instead of the 1,618 this time. So $4,779 of that $5,815 raise has to go towards her health insurance. So that gives her an increase of
already-
just over
wait a minute,
$1,000,
she's
just
already
over
paying-
$1,000. So she would get an increase in pay, in net pay, of just over $1,000.
But what the current contribution to health insurance, it's going from 6% to 12%.
Well, what
Okay,
is it like?
gotta
Right
look
now-
at the dollar amount.
25.
What's
Right.
that?
Right now,
Let's
it's
say
6%,
Right now, it's
and in the
6%.
budget, it's 12%.
Well, no, it's 25.
It's 25.
25.
Yeah.
Currently,
What do you
she
think you get?
Currently,
12%.
she contributes $1,600 a year. Based on the platinum plan and taking 25% of that cost, she would now be contributing $6,400 a year instead of $1,600 a year.
That's too big an increase for 1 year. I think we
So
should go
that's
with
a
the
big
12%.
increase. And so if you take her $2 an hour plus her percent, and then you subtract that increase in the amount she has to give for the health insurance, it comes down to a raise of about $1,000.
And what if it's 12%?
If it was 12% and you did that, then that would come down,
Over 2,000.
1,482, so that would give her, well, it would give her an additional, $3,000 if you went to 12 instead of 25.
Right. Yeah, I think we need to go to 12. Not 25. 25 is too
And
big a
that's
jump.
for
Hmm?
You mean for everybody?
That's negotiations. Joel says we're not negotiating for her, so we can say,
There's other staff that aren't in highway.
You know, the staff, right?
right,
About half of her, union, the other half or not.
It's not, I mean, instead of not talking about a specific position,
Talk about the
But-
general case.
but everybody, all the staff, with the exception of highway, is getting a what % raise?
What was,
Cost-
my intention was
Isn't there a
to,
cost of living?
was to add, think of it in terms of dollars an hour.
No, I want percentage.
Well,
Like what is,
he didn't do percentage. He
I
did
did- I
$2
did
an
a- I
hour
did a
plus
comp-
4% on
I
top
did
of
a
that.
combination thing. I
So
said,
so we don't have that number.
because, you know, a percentage for somebody who's getting $60,000 is different than the same percentage for somebody who's making $40,000, you know, in terms of dollar amount. But the increase in the cost of the health insurance is a fixed dollar amount, whether you're making 60,000 or 40,000. So in order for the person who's making 40,000 not to be penalized, I wanted to have the increase in compensation equal the increase in the cost of the health insurance if it went from 6% to 25%. That's where the $2 an hour came from. That was supposed to cover the increase in the cost of the health insurance, so there would be no net increase to the employee. We'd be increasing their compensation that much to cover their contribution toward the health insurance going forward. In other words, you're going to go from 6% to 25%, but you're going to increase their compensation enough to do that, plus 4%. In other words, it'll be a 4% real increase in take-home pay, if you will, and then an increase in apparent income, that included $2 an hour, which is $4,000. There's $4,000 for the clerk, and it's $4,000 for the planner, it's $4,000 for code officers, $4,000 for Laura. It's the same $4,000, whether you're making $60,000 or $40,000. That we're covering the increased cost of the health insurance that way. And I want to do the same thing with highway. If I can talk them into doing 50% in 1 year, I would do it, and I would add $6 an hour to their compensation just to pay for the health insurance.
No, it would not.
Why not?
No.
There's one other thing.
Can I
Why
give you another
not?
example? Can I give you another example that might help? Let's take the code enforcement salary. I just did the calculation.
Okay.
I did with the code enforcement salary. If you take the amount that he did in 2022, 57,001 was the budget, minus out the 1,618 that he's paying for health insurance, okay? He's actually getting paid 55,383. Now, if you take it and you give that $2 an hour raise, okay? You give a $2 an hour raise plus the 4%, brings him up to the new 63,441, which you see on the budget. Now, minus out the new amount, the 25%, 6,397, brings his pay up to net pay up to 57,044, which means that he's really getting an increase of $1,661 a year, which amounts to 2.99% increase in pay. So he's basically getting like a 3% raise if you're using the 25%. I guess one of the things that-
25%.
Well, it depends on what 4% of what.
Let's ask this. Let me ask this question if I
Wrote them
can.
down. I wrote.
Let's say we-
But I mean, is it 4% of the what are you increasing 4%? Is it compensation without the contribution to his health
That's
insurance?
correct. It's 4%. It's 4% of their current salary.
Well, no, the current salary includes the
57,001.
contribution to health insurance.
No, 57,001 times 4%. You said give them a 4% raise in their salary. So that's what I did. 57,001 times the 4%, and
where are
add
we?
that on to the $2 an hour.
Let me find it. What line are we on in the budget?
Code.
8010.11. Let me ask this in another way. Let's say we didn't change health insurance at all. Let's say you left health insurance and that was not even an issue on the table. We were not in a negotiation year
Right.
or whatever. And you
Right.
were just going to give percentage increases in pay this year. And you were
It would
going
be
to
based on,
assign
it would be
increase.
based on total compensation.
Right. What would you in this year with inflation, thinking about inflation, thinking about other things, what would you be thinking to give as a percentage increase to the employees? Whether it be highway, anybody, what would you think that would be in your mind to give as a percentage increase? Without even looking at health insurance or anything. What would that amount be, do you think? Would it be 2%, which is what we've gotten in the past? Would you think more? Would you think, what would be on your mind for that, do you think?
What I put in,
Oh, wait, I'm not trying to put you on the spot to see how generous you are. That's not what I'm doing. I'm just
Okay.
saying, what would you think?
trying to say what I was figuring was 8%.
An 8% increase for everyone.
Because inflation has been running at better than 8% for way over more than a year. So that's what
Yeah,
people
but
are seeing.
That's just, I mean,
And that's, none of these figures are based on that, which
We
means,
can't-
and we're already
Well,
at 10%.
they were
going up,
initially,
so
but then,
I don't think we can
Jesus.
afford it this year.
they are for the people who are not paying health insurance.
Huh?
That's a whole different story. And the other thing
Even
is-
the part-timers, Joel said do this for the part-timers as well. The ones that are not on the health insurance. Give them the $2 an hour plus the 4% of their current rate as well. So that's what I gave them on this budget.
Is this mic on?
It is now.
Okay. Yeah, okay, we're not even talking about what the difference to them about between legacy and platinum,
Platinum.
which should enter into it because you're asking to change this in 1 year and not considering that difference for them.
That makes a little bit of difference.
And I don't know. I don't know all the benefits that will go away for them.
Well, it's not so simple because some things are, they're different, you know. So the platinum plan is a very good plan. It's not like it's in some way inferior to the legacy plan, but so, the difference is in things like, you know, how much the copay is. In one case, it's a percentage. In other cases, it's a fixed amount. And so it depends on what kind of procedure you happen to need, you know, whether you're better off or worse
Right,
off, you know. So it's hard to compare because they're apples and oranges, really. But
It's
they're
more
both
based
very
on
good
a-
plans. But there is
Yeah.
a savings, though. I mean, the savings is well, I mean, it's worth asking the question that Catherine just asked. If you their contribution, if we just went from the legacy plan to the platinum plan, would decrease and will decrease next year if we go to platinum by a certain amount. So they would be contributing less, and that's a little bit more money in there, a little less that they have to contribute as their share of the. But when it's only 6% that you're starting with, it's not a whole lot of money. You know.
Yeah, but I wasn't talking about what's in their pocket. I'm talking about what the benefit does. And once we go out of that, we don't go back into
No
it.
turning back. No.
I think it's perfectly reasonable to move to the policy because old ones are phenomenally outdated. And I don't think we want to stay with something like that. But I don't think we want to go jump in 1 year from paying 6% to paying 25%. I think we should go to the 12%. And if we can choose that for all non-contract ones, non-union ones, then I think we should do that, 12%.
And I disagree. And the reason is because I'm proposing to increase it more because I want everybody to have more skin in the game. It says now look, we're asking them to pay that much more. We're going to pay them whatever more it turns out to be in order to go to a higher percentage. In other words, if we could go to 100%, I would pay everybody who's got currently insurance $12 an hour more to pay for that. Plus the 4% that we're talking about, you know, real increase.
Sounds good in theory, but in practice, that's not how the health insurance system works in this country.
How
And
is
we
it?
need to-
So what?
It's private insurance and we've got to make sure we have the right coverage. And
We're not
changing-
changing we're not talking
And
about
changing
coverage.
a dramatic thing in 1 year when we're at a problem in terms, especially in terms of employees looking at all sorts of other issues, then it's not a good idea to make that change now.
Yeah, it's revenue neutral.
It's not,
Why is it not?
because the numbers didn't show that as revenue neutral.
It should be revenue neutral.
But it's not, and you're leaving things out. I think we should go to a 12% increase.
Maybe one of the things we could do is sort of see it side by side.
It
have
should be
Have an
revenue neutral if we
example
do
of
it right.
what
And that's what I wanted to do.
4% increase with a 25% contribution and a, I don't know, 3% increase with a 12% contribution or something like that.
If we, normally in the past, when we've done our increases, said, well, we want to do a 2% increase, like we've done it for like 3 years running,
Right.
2%, 2%, 2%.
Right,
It was 2% of the number that's there, the
Uh-huh.
tally. wasn't 2% plus a little bit more or a little bit less because of their insurance. It was 2%, 2% of that number.
Right,
So what I intended was 4% of that number plus $2 an hour.
maybe, I don't know. I'm looking at this and wanting to slash a number of things. And I'm worried about, you know, maybe needing a 5-year spreadsheet to include all these numbers and what your vision is, so that I could actually see how it would pan out in 4 or 5 years. I'm worried about the increase to the residents this year. I'm worried about,
Yes.
I'm worried about salary increases, you know, in even, well, I'll say the clerk line that other lines aren't getting. I mean, I'm feeling like we should increase everybody the same. I know highway's different. I'm
we have
wanting to look at, you know, what are we gonna do with IT and what do we, I want some money to go towards website and newsletter writing, and I
Right,
feel
and
like
that's not in there yet.
we need to tighten up. You know, we haven't gone over the tax cap in a lot of years. We have a couple of years.
Well, we know
And
that. Actually.
I'd like to keep it as low as possible. And I feel like we're heading in a direction that's not that.
Not that.
No, it's definitely not that.
You know, and I'm not just picking on the town clerk line. I mean, I think there may be other lines that we could slash a little bit. But you know, we need to add protection, no matter which way we go with IT. You know, that will increase our costs a little bit, even if we say with SCT, you know, we need to add more to that budget line. So I'm a little worried about starting something that's pushing us way over where I want to take taxes to go. That's my 2 cents. And you know, even feedback from SCT included things like here, you know, a plan for the next couple of years or
Yes.
something.
Yes.
So
Yeah.
you know, we don't have to do everything at once.
Right.
And I'm just a little worried this year. And I think a lot of people are suffering, and
I've heard the story
everybody's
now for
assessment went up.
3
and I
years
know,
running. You know,
it's- Yeah,
we have the pandemic is here. We can't hit people too hard. You know,
Yeah.
pandemic's over. Well, people haven't recovered, so we can't hit them too hard.
no,
A
you're
year
right.
later, well, we know we still can't. You know, there comes a point where you can't just,
No, I
decrease your
know.
fund balance,
I
and you can't lean on
Yeah.
your employees to just to have unreasonably small increases when the cost of living went up 9%.
Yeah.
Year over
Yeah.
year.
Yeah,
Well, that means if we're not giving them comparable in compensation, they're losing ground.
You're not even talking about giving them 10% increase. That's
No,
not what we're even talking about. So I don't know why you're bringing that up as an issue. We're not talking about that. That's not in the budget here anywhere.
No, but what is in here is basically 8%.
$2 an hour plus 4% comes out to be 8%.
I think that's a
Yeah, it's not
lot.
going to be
I
8% for
think
everybody.
that's a lot.
Depends on what the
I know-
base
I know
number
the
is.
Cost of living went up. I know that. I know that, but where else is getting 8% increase in salary? I'm
Well,
not talking
Can I give
compensation, I'm
you
talking-
The
another
highway
example?
people,
Well, they may,
Yeah.
and that's not our
but
fault.
where it's going into where the labor is tightest. It's going into people who drive buses, people who are police officers, even restaurant
getting
workers.
8%.
Where the wages are rising,
They're all getting 8% increases in rates,
or more.
really?
Where's that based on?
Westchester.
I haven't seen that anywhere. Where are you basing that from?
Westchester.
Yeah.
No, I don't mean to make light of it, but I still need to work on. I want simple and what are staff saying as far as, are they, would they, people be very upset if they got 4% instead of 8%?
Well, I mean, it's a real 4% that's in here.
Right,
And,
Most of it, is it being eaten by the contribution to the insurance?
no, it's 4% plus the $2 an hour. The $2 an hour, the $2 an hour is intended to cover the increased cost of insurance.
It does not when you have different salaries to start with. We're not talking about
That's
this.
why,
We're gonna-
that's why it's $2 an hour, Pat, and not a percentage.
right. Yeah,
So $2 an hour, if you treat everybody, you're treating everybody the same, every full-time person the same, $2 an hour is about $4,000 a year. That's the increase in the cost of the health insurance. So we put that in, and then we're giving them 4% besides. That was my intention anyway.
And that's based on 25%. If they go to 12%, then we don't do it that way.
No, if
I
you
think
go
we
to-
need to look at
Well,
those
we
exact
don't
numbers.
have to do it. I mean, if you go to 12% instead of 25%, then I wouldn't be giving them the $2, because if you're going to give them the
Right.
$2,
Right.
then you're giving them a lot more than
Right.
4%. So that, my intention was to increase their contribution, but then basically to fund it.
right.
So they have more of a stake in what it costs to provide the health insurance.
And why is that? They don't have a stake now because the insurance covers a lot?
6%, there's a continuum, okay, from 0 to 100. At 0, every incentive is there for labor to want more everything, and for the
What do you
town to
mean more
pay for it.
everything? You mean that they go to the doctor more often?
The most expensive plan, the most complete coverage that anybody could want is
Yeah.
what you would want if somebody else is paying for it.
Well, hell yeah.
Yeah.
No matter
Exactly,
what,
right.
no matter what.
Exactly.
You wanna be coverage that you don't get sick and you don't get coverage for it. You wanna be
The
medicine
the
covered.
coverage- The contribution right now is 6%.
But I mean, if those of us who were not having their employer pay for their health insurance, make judgments about risk and cost. If you're healthy, if you can set money aside, you're willing to take a higher deductible and run a risk that you're betting that you won't get sick and you won't have to pay a high deductible, but you're paying considerably less than premiums in order to have the policy. And this is true whether you're at 25 years old and on the private insurance market, or where you're in Medicare and trying to choose among 6 different options, with different amounts of copays depending on which one you choose. You're going to make judgments and based on a trade-off between cost and risk. If the risk is not yours at all, but your employer's, you're going to want as much as possible. You want to minimize your risk because somebody else is paying for it. So there's an incentive to want the very best possible coverage at the least possible cost to you. And if the cost is 0 to you, you're going to want to have the least possible risk. Puts all the risk on the town. You end up with the most,
But nobody's got 0%.
Yeah, we're not
Yeah.
talking
well,
about 0%.
we did until Rick negotiated the 6,
Yeah,
and so they got a little bit of skin in the game. 6% is not a whole hell of a lot.
6%?
I'd rather have us be at 50%, where half the risk is ours and half the risk is the employees. Then
The risk of dying, are you talking about this?
I'm talking the risk of getting sick and needing health care.
Oh, great.
That's what insurance is about.
Okay, so,
That's what insurance is
My
about,
God.
isn't it?
it's also,
Can I give another example?
staying healthy and having good workers is also important.
Yes, yes,
yes.
yes.
I mean, we could go
Nobody's
on
arguing that
forever
we
about
should-
this. I'm just wondering if we could make Laura do some work.
Yeah, but
And,
But I,
so this, I'm sorry, Laura's
it's
right here.
okay. Oh, it's okay. I
So-
made another example. I came up with another
This is
example.
a
I-
4% increase plus 2
That's my intention,
with a
anyway.
25% contribution.
Right,
That's what this is.
right.
How about
mean-
this other example I've got?
Could we get the figures for a 12% contribution and a what raise? 2%?
4% was the raise.
Who says that it's 4%?
So you want to make it,
His
you
raise
want to
is
make it less
4%.
than 4%?
He wanted to raise the 4%,
Yeah, but I mean, I'm saying.
independent of the money for the insurance, because that was a separate,
I mean,
so
is
if we-
that, forget about Joel.
yeah.
I mean, is that what we want to see? Is a
4%
4%
sounds-
increase across the board? I never got a 4% increase.
You never faced inflation at 8%
I just
either.
work for the county, that's all.
Can I give you an example of something? It might make it easier.
4%.
Actually, I
This
think what
video.
might be easier
For
is if we
4%
can see
increase.
some of these things as opposed to just hearing them. If you can
Like,
give them to us
it's-
and we can have it for the
Sure.
next
That's what
meeting.
I'm asking her for. I mean.
Yeah,
so
right,
this
you
is
want-
the
That's
one-
so,
What do you
so
want?
not
If
like,
we had-
Our
if
code
we had
enforcement
a
officer at
4%
his rate of pay.
increase with a 12% contribution.
yeah,
I mean, just
that's
to-
4%.
Just to look at what a difference that would be.
Yeah, good.
in the
Well, I've
budget.
made up something for you here that I took our code enforcement officer. I gave him an 8% raise, okay? Just 8%, not the $2, just an 8% raise.
Right.
Subtracted out the difference in the amount that he would pay for health insurance at the 12%, okay? And that ended up to be a $978 raise, which was in total of 5.38% increase. So he received, that's why I was asking you, if health insurance and nothing came into mind this year, what would you guys suggest as the rate of increase in pay? 2%, 3%, 4%? What would be in your mind to increase that rate of pay?
Right.
For this year? That's a key number, and then we can make the rest of it happen.
Yeah,
Okay, 4% does sound reasonable.
That you would do a
That's what you said.
4%,
Number.
4% overall, okay? This
Yeah.
right here gave Steve a 5.38% raise overall. So if
Okay.
you took overall, because of that increase in health insurance amount, okay? So it ended up giving him at 8%, a 5.3% increase overall, taking his amount last year in this year minus his contribution, then his amount at 8% next year minus the new contribution,
Okay,
finding that difference and then coming up with that percentage overall was a 5.3% increase in pay. So if you're
And what
thinking 4%,
what about,
and I know how to
7?
work the figures.
What about 7%?
Okay, so that would probably have taken him down to maybe
Well,
a 4.8%
Get an
increase.
8% raise.
But if you're looking at a 4% overall, that's really, for me, doing the figures, that's all I need to know. If you want a 4% increase in pay overall, but also help compensate for that extra in the health insurance, I know how to work the figures from there.
I have a question, and then can you make a table
Yeah.
that shows?
Yeah.
I will.
A
Yeah.
table would help me a lot.
Yeah.
I will make a table and I'll put it on there in several different ways. But I also want to put the employees on so that you can see what that kind of percentage does. Because if you take someone who makes a lesser salary and you give them the same percentage increase that you give everybody else, but they also have the same amount of additional health insurance taken out, their amount of compensation and their percentage of an increase is much lower than the others.
Right.
Okay?
Yeah, and you're basing this on 12%, right?
12% of the health insurance and you want to see them have a 4% raise overall.
Can you
I
do
make the
several?
figures, I'll give it to you.
Can you do 4%, 5, and 6% so we can see a comparison?
Gotcha. Yep.
4, 5, 6, and 7. You
I
just
would've
did
gone
8.
to
I'll
3,
do 4, 5, 6, and 7. You'll see it very clearly how it's being calculated and you'll
Great.
see the difference
Great.
Wow.
immediately so that you have this in your hand tomorrow. How's tomorrow?
Yeah,
Look in your email for tomorrow. I'll have it done.
I don't like,
that means we are going to have another meeting before the public hearing.
Yeah,
Oh, yeah, oh,
Through
absolutely.
all
Yeah.
this stuff. So today is Tuesday. When are we gonna have that meeting?
well, that's another question, of course.
I know it's more work. Could you add a 3% line to that?
Gotcha.
I don't like having the health insurance sort of rolled into the total
No,
and then having it, and then because it penalizes the people who make less money versus people who make more money, percent
That's how
increase.
you can tell how to shift their compensation for those that are making less. So say, for instance, you wanted a person who made a lot less to still have a 4% raise. I can put you on a number of what you need to increase them to make sure they have a net 4% raise.
Good, good.
Okay. I
Oh,
can
thank you so
put
much.
a number on that number that person should receive to cover their increase in health insurance and give them a 4% raise. I can put you on the number. I just needed to know that 4%. If I know that 4% and I know what we're looking at and you're good with 12%, I can put it right down there, what each person should get for a raise to meet
Great.
your goals, to meet your goals.
Oh,
So,
thank you so much.
I need to interject two things. One, we haven't approved the abstracts for the general fund and the highway fund for today.
Right, that was supposed to happen
And
first.
two, I would like to also discuss my salary and why it needs more than a 4% raise. And I would like to discuss the IT situation that Catherine spoke with SCT about, and to discuss the third proposal that I have from HPM.
I don't think we can discuss specific proposals right now because we haven't seen them and we've got to interview people before we do anything like that. But what's important is
Sorry,
to
what?
look at,
Okay, wait,
we
hang
have
on,
to
what?
interview, we need interviews and we need references from all of these
Interviews
people.
for what?
For the IT.
The IT. In
Yeah.
addition, but
Okay,
what's important looking
It's
right
something to
now
work
is I cannot justify a budget when we're looking at a 10% increase now already that goes from $10,000 to $43,000. I cannot justify that.
so I want to hear what Catherine had to say with SCT and why she wants to stay with a company that has failed us over and over and over again. And then I would like to discuss why you would not be willing to entertain this third proposal that I had, which I believe would be more in line with what you would like to see. And it would also leave us slightly more secure than we are now.
Well, we could talk about that, but we better do what we were supposed to do.
let's do the warrants
Let's get the warrants
first.
out of the
I
way.
mean, we were gonna meet till 5:30, but,
Yeah, it's already.
so I got a meeting at 7.
Right, we have a little bit.
There is the
of time.
BZA meeting at 7.
I move
What's left?
the highway,
Highway.
warrants.
Second,
What's wrong with the general fund?
Well, there were a couple things, and I don't know if it,
I
mean-
fixed them. They are all fixed.
well, they weren't
Want me
fixed
to
when I
come in
looked
there
at them.
and show you exactly
They
where they
weren't,
are?
Janice, they weren't fixed when I looked at them less than
They
2
were
hours.
fixed this morning.
I
The
looked
two
at,
that
I
you
did
found that
these
were not have since
2
been
hours
fixed.
ago. I don't, I'll just vote no, don't worry about it, Janice. There's things that are wrong with it and I can't.
Your town that you don't pay the bills on time. It's fine with me if you want to rack up those extra late
Okay, one of
fees.
them still included taxes. There were a couple things that were still wrong with it when I looked at them.
Okay, we check.
2 hours, well, 2.5 hours ago.
Can we check?
They were fixed at 9 a.m. They were fixed
Not
yesterday.
when I
Let's-
found- Okay,
let's
not on my computer, they weren't.
Let's not
So-
argue about it. Let's,
Let's pass the highway.
pass the highway and we'll do the other two. It's not
Yeah.
that far away. We'll do it Monday.
well,
I'll second the highway.
okay.
Some of these places need to get
Is
paid.
there anything that needs to be, is the highway good to go?
I didn't find any problems in the highway.
I didn't
I
either.
can't, no, right,
Okay, okay. So we're vote on that one, Janice.
yeah.
Yep, Connors,
Yep,
Hunter. Yes. Woodworth
Yes,
and Gagnon.
Yes. Okay, so now there's still the general fund. Let's focus specifically on the numbers that Leslie thinks are still incorrect. If we could
Okay,
take a look
well,
and see whether they have been corrected.
319, the amount of the $6.50 on the voucher. I know it's picky, but it was $690.53 on the voucher. All the account numbers were different than from the abstract to the vouchers. 316, the numbers were different. I didn't see the tax taken off of 304. Account
All
numbers.
right, let's take it one at a time, Leslie. Give me 1 second.
Well, I don't want to sit here and correct them.
You just want to not pay bills?
Janice, that's really not helpful. Of course, we want to pay bills.
Well, Leslie's being not helpful either. I fixed
No, we
everything,
can't.
and I would like to show you that everything has been fixed.
Well, let's take a look and see.
Here
what it
is voucher 319.
I don't know what they weren't fixed on my computer. So
Okay.
I cannot control what you see on your computer. I can only control what I do and fix. And here they are. Here is town hall mowing September. A16-2042, $135.20. A16-2042, $135.20. 7150.400,
The voucher-
1760.
On the voucher for $690.50. On the voucher, it says $690.53. Okay,
Where?
on the voucher.
Which voucher? I'm looking at the voucher right now and I'm sharing it. So there's this $690 and $50. This is the voucher. It has been fixed.
Can't see the amount.
690.50.
It's right here. What can you not see? Do you need me to make it bigger?
No, you had it covered up.
Okay, there you go.
How about on the bill itself? How about on the bill itself? Did
On
you
the
have
bill
to go
itself,
right
you
from-
have to add it up. It's Peters Road, 9865, Bald Hill Road, 19730,
I'm not voting on
Nelson
it.
Road, 9865, West Danby Cemetery, 295.90. They're all added up.
Yeah,
Janice, the reason
So
that she.
these four are right here.
No, I'm sorry. When I looked at it less than 3 hours ago, it was not fixed. I cannot.
And I am telling you that 3 hours ago, it was
Janice, I
fixed.
understand, Janice, I understand, okay? But for us to be able to come and approve these, we need to be able to either get them, and I know it's difficult, but we need to get them in a timely, in a
Yes.
way that I had things to do today, and I came home and I went through them, and there were still some errors. So I knew that if I actually said, when I sent you the email saying there's still these errors, I didn't have time to go back and look to see if they got
And
corrected.
I responded. I said
Well,
immediately, these are
done.
fixed.
That's it.
But you already said that they got fixed at 9 AM and she checked it in the
Yeah.
afternoon and they were not.
So let's go, just vote on it. Go
I
ahead.
don't know why her computer shows her old versions. I
It's not her
cannot tell you
computer.
what it is about her computer that refuses to allow her
It
to
was
see updated
Zoho.
documents.
It was Zoho.
It's, it's not her computer that's doing that.
where is the discrepancy?
Oh my God, I am so ready to just working under these conditions. I do not get paid enough for this shit. I am trying to make everything smoother and easier to find. I know we had this discussion over email before, but this is ridiculous. Hey, Ted, how are you doing? What do you want to say?
What?
What?
His face just popped up on my screen. I'm just curious. So it's, you know what? I don't care. You're the town board. You pay the bills. You make the decisions. It's
Right.
not my department. I'm just the town clerk. I control all of the records and I handle all of the laws and I handle all of the money that comes in here. But whatever you want to pay and however you want to pay it, totally fine.
Yeah, we know that.
I think we have a problem with sorting out jobs that might be in the way of trying to do the vouchers with the abstracts so that we can pay.
You know what? If you don't want to move forward and do things simply, that is fine. It's
This
fine.
is not simpler nor easier.
It's not a
It
question.
is.
I don't think
You
it's a
all
question of
have
simpler and
this
easier.
block that you just
Janice,
want
I
to
don't think
complain
it's-
about
Janice?
everything.
Janice, I don't think it's a question of simpler and easier. It's a question of timely and accurate.
Yeah,
And my system is timely and accurate, but everything
No.
I have to do to bend over to make sure Leslie can see it properly takes up 10 times more time than I have.
and that's what the auditors say we're supposed to do.
Well, and now you're finally doing it. Congrats,
No, I mean, the board's just doing its job.
Wow,
which is what I'm trying to do too.
somebody move it, somebody, one of you guys, you guys move it, I'll just vote no. Sorry.
Well,
I don't feel comfortable with this fighting going on and making decisions. I really don't. I feel the thing is that we need to figure out how we can pay these people, and then we've got to make a change here. I don't know what it is.
If you want to go back to your antiquated system, I'm happy to do that. I give up. I
Doesn't have
will not
anything
try
to
to make
do-
town processes more smooth. I will not try to make them easier. You know what? Deal
It's-
with what you want to deal with.
It is not smoother. It is
Oh,
actually
good fucking
harder.
God.
No, I don't want it.
I don't think it's a question of which system we're using.
Yeah.
It's a question of
Accurate.
timeliness and accuracy.
Yep,
Yep.
and timeliness and accuracy takes me a boatload of time when I have to use Williamson.
Well, that's part of the job, though, is getting it right.
It is not part of my job. I can use software I want to use that will make my job easier and smoother.
I'm not questioning the software, and I don't think the board is either. What
Oh, I'm pretty sure
some
they
people
are.
are maybe, but but the
I can count on.
should
well, I
not
can't
be, there
count
should not be
because
discrepancy.
the number of complaints I have gotten about Zoho are just through the roof. And you know what? It's fine. It's fine.
It's not fine, Janice. That's the problem. It might be fine for you, and it isn't, it's not okay for an argument to say that we want to go to antiquated old ways that are not accurate. This isn't constructive.
The problem is, we've had many times where there've been, it sounds like the system is better, but
The
it is
problem
not
is that I
better because they are
continuously,
wrong.
incessantly get pushback that why am I doing things like this? Why am I doing things like that? Why can't you just shut your mouth, sit your ass down in your seat and do what you're told?
That's not what I was saying. In particular, at the last meeting, one of the major differences, there were two numbers were transposed on the voucher and the abstract. That has to be changed. That the problem is not the system, it's the accuracy of the data going in. And we're not getting that accuracy.
The accuracy is there in my system. It's the difficulty in trying to get it to you in the form that you want it, which makes me then have to retype everything.
Janice,
And
you
then,
didn't listen to
yeah,
my.
my finger
Janice,
slips and I transpose fingers.
Listen to
Not
my
sorry.
explanation. You had two numbers that were transposed. That was not the system doing it. That was inaccurate, and we can't vote for something like that. That's wrong.
That is not the
It's
system
wrong.
doing it. It is me trying to get it in a format that you will fucking accept. Because everything I do is like, oh my God, why are you doing it like that? Why are you taking up so much time? And the time that I take up, I'm trying to fix
I'd
it
like to
in this
move
little
the
box
general
that
fund.
will be acceptable to you. And yeah, when I have to type things over and over and over again, my fingers slip. It happens with.
I'd like to move the general fund. Somebody want to second that?
Well, if you're going to vote against it, I'm not sure we're any better off.
Well,
that
it's only
way.
one person.
Well, I'm not
I'm
willing
not ready
to
to
vote on
walk
it
away
either
from
till we
this
get it
meeting,
right.
and I don't really want to record anything because I do not get paid enough for this.
Janice, the board is talking to each other right now. Can you please let us do that? What were you saying, Joel?
Yep, I see this meeting.
What I was saying was that it's important that we get it right.
Yeah.
So, I mean, I'm not willing to vote for it until we fix the discrepancies.
Well, she said they.
You know, and in the time we spent arguing about it, we could have gone over the few things that you had that didn't agree with you know, to make sure that it actually was correct. Because where are we? Well, I suppose we could postpone voting and until next time, but we still need to fix the discrepancies.
Right, by next week. We can do it by next week.
Well, I am more than willing to go home and look and see if they got fixed. And then we can vote on it next time, but I mean.
How many people are on that are not gonna get paid and need to be paid? Because a week is another week.
Well, yeah, well, of course we didn't. We haven't asked the question, when are we going to next meet?
Three of us could get together at some point.
Because I mean,
But if there's.
We have
the
another
numbers
meeting.
are different, it's gonna be the same thing.
If we have another meeting, we can, and we need another meeting before the next one,
It would
because
be
the next
nice
one
to
is a
have-
public hearing on the budget.
it'd be nice
So-
to have the meeting before next Tuesday.
Yes, it needs to be before next Tuesday.
Yeah.
It can either be Monday or Thursday, it would appear.
Or,
I think what Janice, what Lester was suggesting is that we have a short
We could
meeting
just have a
to
little
go
meeting
over
with two
the
people.
abstract and the voucher.
Sure,
But we need another budget meeting.
we
We
need
can do
another
it at the
budget
same
meeting
time.
anyway.
yeah,
One thing at a time.
We can do the same meeting. We're not gonna have two separate meetings for both of them.
No, I
that's right,
don't want to do that.
yeah.
So we need another meeting, and we'll do the general fund at the other meeting. So
How
it seems
about-
to me
What
Thursday
are
or
people
Monday.
doing tomorrow? What's tomorrow?
Wednesday?
Tomorrow's Wednesday. Well, it doesn't give Laura a whole lot of time to do
Yeah, I think-
things
Well,
Can
for
we
us.
not,
Thursday would be
can we
better.
like not meet on Monday as an option?
If
Wait,
they're
wait a
ready.
And I
minute.
know that's ridiculous. I can do it. I can do it. Monday's Halloween. It's a big time for me and my granddaughter's plans, but I cannot do that if you want me to. That's all right.
Yeah, it shouldn't be Monday, that's Halloween.
What's
So
wrong
I'd
with-
say
what's wrong with-
next
What's wrong with Thursday?
Thursday's fine.
It's a big deal in our town. The whole town comes alive. I have 600 kids showing up at my door.
I'll just make it, okay, yeah.
Yeah.
So,
Can we
Does
meet this
that give
Thursday?
Laura enough
Can we
time?
meet this
Does that give you
Thursday,
enough
this
time?
Friday?
what?
Does that give you enough time, Laura, Thursday?
Yes, it does. I'll take tomorrow. I'll make all the change, give you all the information you need. Tomorrow, you got it.
Okay, so let's do Thursday.
Hope I'm not doing
At
it.
what time? What time?
6 o'clock?
6? I think it'll work. I have a TCOG meeting at 3, but it doesn't run more than 2 hours. It should be okay.
And if we
27.
have to, we'll meet Friday again. Whatever we have to do to make this happen, we can do.
Right,
Yeah,
right.
so we need a motion though,
What?
to set that meeting.
Meet again? I move that we meet Thursday at 6 o'clock.
6 o'clock.
For the
Second
dual
that.
purposes of approving the remaining warrant and working
Budget.
the budget.
Yep.
In the kitchen?
I'll second that.
Oh, I'm sorry, all right, never mind.
Any
You
further
were- no,
discussion?
Never mind. I was gonna ask you to look at the calendar, but forget it.
I'm looking at a calendar.
No, she's talking about her own.
Her own calendar,
She's
right?
on the phone.
Oh, I see. Make sure that it's okay. Fair enough. I'm not sure we still have Janice with us.
Are you-
You check with that, I'll check.
Thursday, the 27th?
Yeah.
At 5:30?
I'd rather earlier.
No.
I don't know about Laura.
Okay, it starts at 5:30? Okay. Can we do it early in the day, like 3:30? Is that possible? We have something at 5:30.
I could do it at 3:30.
Say again? No, I got a TCOG
No,
meeting.
obviously,
As I got
no,
TCOG, the Tompkins County Council of Government meets at 3.
Okay.
Yeah, 3 to
Five,
4:30
you want
or
to
so.
do five?
What's Friday? Anything else?
Friday the 28th.
Uh,
Leslie said something about.
Joel, what times look good for others? I could come in person if someone wanted to come before 6, or come before 5, just to look over a few things and have further explanation. I can make myself available anytime.
Friday.
Then we can wait for a meeting for
So
you.
later on Thursday or? is it-
No, we've got something, we have something.
Absolutely. I mean, Vice Chair of the Tompkins County Council of Government, then they're there.
What about Friday?
Friday's okay. You want to do Friday? Thursday doesn't work even later?
No,
No? Okay. Well, then
3
Friday.
o'clock might work on Thursday. too.
Well, that'll be awfully late though. Yeah. Okay, so Friday's all right though.
Friday instead of Thursday, you're saying?
Yeah, Friday.
Okay,
6,
Friday, and what time? Hey, guys?
6:30?
Why are you going to start late? What's the earliest anybody can start?
Well, I was just kind of hoping we could make some use of the daylight.
You are always looking at what you do for your daylight time, and we're also talking, there's 3 other people and Laura, and you're asking us to work over the night on a Friday.
Yeah,
Well, yeah.
I think afternoon is preferable.
What?
What about,
Afternoon
what
would be
about 4?
preferable.
4, okay?
Probably, if we're gonna do it afternoon, I would do more like at 3, so we're done.
I mean, I've been wanting to do my leash for a long time, but we're doing all of this because this is what we're having to do. This is our job. We have to get this stuff done.
That's correct.
Yeah, but you can't rake leaves in the dark.
Sure you can, get a
I've been
light.
wanting to do them for days. That's a separate subject from this. But when we use our own personal reasons for wanting to not do it that aren't appointments, etc., I think it's not fair to the rest of us. And I'm saying that
3 o'clock Friday?
meet in the afternoon if we can.
Yeah, although
Friday,
I would
try
point
and
out that
keep it
it's
to
hard
2
for,
hours.
it's a lot of, for people who would work normal working hours, it's hard for them to attend these meetings if we have them at 3
Right.
o'clock in the
No, you're right.
afternoon.
Oh, hell, on Zoom, they can meet
You're right.
from their
It's
office.
a budget meeting, hopefully it's a budget meeting, we don't talk about anything else.
Yeah, except that,
So-
yeah, it's just the budget meeting and it's the warrant, the one warrant.
If we did Friday at 3, we
Friday,
could also,
Friday.
Friday at 3, if say we did Friday at 3, we could also do Monday at 3 if we needed more
Well,
time.
if we have to, we could do that in addition, but why don't we do
Do
Friday
that
at
in
3? and see
addition.
how far we
We'll do
get?
Friday at 3 and then see where we
Yeah.
end up. I'll
More
put it
time.
together, get it all out to you over the weekend so you can see some final figures. You'll see the final amount for the budget. Joel will sit down and go through it. And you get it out and be ready for a public hearing.
Yep.
Did I make them, I move we meet Friday at 3.
What's the last day that we can have a public hearing?
Meet
I'm
Friday
sorry,
at
I
3.
don't have my calendar.
We'll do Friday at 3, and I'll second that.
Next Friday, but
No, no, no.
Okay,
Okay,
all right.
Friday at 3.
Jeez.
So,
The other question that I guess.
We need to vote on that, and whether we get a second.
we have-
We need to decide this. We need to vote on it, and we need a second. Is
we have
there
a
a second?
vote. I seconded it,
Okay, then we need to vote.
yes. And we're not going to have the clerk to do it because she's not in the office. So,
No? You are?
Well, we
Sure.
we're still being recorded, so.
yeah, that's right. We can hold the vote.
Yeah, yes, yes.
Yes?
Yes, yes. Okay. 3 o'clock on Thursday, on Friday rather. No. But for the dual purpose of approving the warrant and the
Yeah.
remaining warrant and working further on the budget. Okay.
can we go ahead with the line items here? And keep talking about the town clerk line items and what we've got in there for oh, where is it? Where is it? I'm
IT?
sorry. Yep, town clerk, and continue on with website and information technology and see where you want to be with that. You guys
Okay.
know what you want to do.
Yep. Do you want to talk any more about this anymore tonight?
No,
No?
Well, the
Productive.
BZA meeting's
Enough
at
already?
7.
not productive.
Okay. So then I guess we're done,
And I
right?
think, we can hopefully get some figures maybe between now and then
Yes.
for
well, of course,
all,
Laura's got it.
for a
She would
bunch
send
of
it,
different
she'll send
things.
them out.
Absolutely.
I know that SCT gave some figures, Janice gave us some papers. I mean, I don't feel like we have a lot of time. I would like to slow down and in the in the 2023, just dig through all of this stuff and fine tune it. I think we need to cover ourselves security wise and
Cost wise.
Yep. So,
Yeah, we
Anyway.
cannot make a decision on anything
Yeah.
in terms of this budget. All we can do is what we need to do is get some kind of an estimate in the budget. But,
Right.
and not
Yes.
10 times what we
Now,
have.
Do you want to go with that? You said something about SCT Computers has another segment of their program that when maybe you have some quotes on that where they have added security and added services. Is this something you guys want to look at
Catherine's
for?
done some investigation of already, so.
And we could go maybe with some of those figures or something for the next year for at least for like info technology and for the website and email maintenance. How you want to approach that, how you want to approach the website and email maintenance.
Right.
You work on that and what you want to do.
And that would hopefully, free up some of the clerk position to, focus on other things and not have to do that stuff all the time, so.
But we'd have to fund it though.
Yeah, right.
We're talking a little bit more.
Well.
Well,
For the information technology, we could at least get a number to fill in there. If it's something from quotes from SCT for added security, added whatever, if you wanted to do that for a year. Not that that would necessarily be the decision, but at least it would give us something to put in a good estimate of what we could be to.
yeah,
And then we'll have, and then the website and email maintenance, if people can be thinking about on what direction they want to do that. I mean, was this something that Janice was going to continue with? Is it something that we're going to, have another company do or another person do? You can get some ideas of how much that would cost to do that.
We're trying to make it so that it's a little smoother and gives the town clerk time for the budget things that are required from her.
Like that website and email maintenance, maybe if you were going to have somebody work on that, in 2022, we put in a $4,000 budget. Maybe you'd want to raise that to 5,000 to be on the safe side. And then the information technology, we'll look at some quotes from what SCT would do or whatever, and at least get a number in there that's going to look reasonable and see if it is something that would work for everyone as we explore this further next year. And we have a dollar amount in there. I think if with just a reasonable dollar amount, that would be great, and we can move forward. And
Yeah, I mean, the thing is that we can change our services, but we shouldn't be doing it under this kind of pressure without
right.
exploration.
that's
Right.
You're right. And we
all
do
we need,
have a
all we need at
contingent-
this stage is enough money in the budget to accommodate whatever we end up doing.
Right.
Right, and we also have a contingent of 6,000, so we have that there. We may find out, that there's some other things. We might not use that contingent grant match of 7,000. We have some other ways that we can do things. And if we don't use much of the fund balance in coming up with this, you'd feel, come onto a system and had to draw 3 or 4 from there to compensate for that too in that next year. That would be an okay feel good thing if you got onto a system. But yet to rush,
I don't want to rush.
no, because I know that
I don't think, and I absolutely agree that we should not. We need to take a careful look at all our options. Just all we need to do is have a ballpark figure in the budget so that we're reasonably covered. And if it ends up being a little bit more, we can cover it with the contingency, or we can even use the fund balance if we have to. But we need to be in the ballpark.
Right.
Some ballpark. We don't need to be in the elite ballpark.
No, well, yeah. We need to, we should put something in that's close to what we think we're going to end up with, whatever that's going to be.
Yeah.
these salary amounts and stuff like that are going to be very accurate by the time you sit down on Thursday, based on what you said you'd like to see, okay? Those
Yeah.
amounts are going to be accurate in there, and you're going to see what that is going to end up to be. So we can pretty much rely on that accuracy of that. So that's going to be good. You think about those other line items. We've hit the other ones. We've hit all the other ones. That's why I was trying to kill 2 birds with 1 stone when I was doing a review. Then we'll get down to looking at what's the tax rate, although that's kind of insignificant this year because it's not comparing apples to apples, but you'll see the amount of the increase in the levy. You'll see that amount per 100,000. You'll get a feeling of it and see what you want to do. And then that's it.
We have to go really soon,
Yeah.
but I do want to ask one other question. And that is, I don't know whether it's a fair question to ask, but you know me, I'm going to say it anyway. Is there a way that we can compensate those really low income people at a different percent? I don't know.
It will be. You will see some different things happen. If you're
Thank you.
thinking about that, you want to see people get a 4%. Now, maybe there is a, and the other ones, and I think the only other one that you, if you are thinking at all, and I know Janice has ideas about what she's looking for in hers, you know, and that might be a part of your meeting when I show you what a 4% would do for her. Okay, where she would be with a 4%, then you guys can talk about it from there, but at least you'll see the net effect of that insurance and a 4% increase for her. And then you can determine whether you feel that's enough, whether you want to go up higher or whatever you want to do. The others, I'll have it in there so it's compensated so you can see that 4% increase in all.
Great.
In all.
Good. That will help.
Okay.
Do we need a motion to adjourn or can we just?
No, we don't.
Good.
You guys relax. You guys relax. It's gonna work. I'm gonna put a lot of time into this. I'm gonna devote myself completely this weekend and everything between now and that public hearing. And it will be a good finished product and it will be accurate.
Okay.
Okay?
Thank
I'm
you.
here.
Thank you.
Utilize me, whatever you need. Okay? Ideas, thoughts, questions.
Only one other statement. This meeting wasn't fun, but it was important and it's unpleasant for many of us. It's not just one of us. So I think that we're doing really well to sit here together at the table and work on it.
Yeah.
Okay.
Amen.
I will put my eyes
I
on.
accidentally closed my Zoom window, which means we no way to. end the
Thank you
meeting.
all. It's gonna work out just fine. It's gonna work out just great. You'll see.
Laura, did Janice make you co-host?
Yes, she did.
Then so you can end the meeting.
How do I do that? Just leave?
No, well, it should be able to, when to leave, but there should be a end the meeting for all, but I didn't see it in mine.
Let's see. I got something that says leave.
Well, Ted, I can't unmute you or anything, but you could maybe offer your thoughts for how we might be able to do that.